Welcome to 𝗠𝐷𝐻 podcast from Emirates Hospitals Group. My name is Dr. 𝗚𝗊𝗶𝗀. I am a consultant pediatrician and I am the host of 𝗠𝐷𝐻 podcast. Our goal at 𝗠𝐷𝐻 podcast is to update you with the latest advancements in medicine, aiming to improve health and well-being for all. Today, we will be speaking about colon cancer. What is this condition? Who can get it? And how to detect it? How to treat it? And most importantly, how to prevent it? For this, my guest is Dr. Ashwini Banerjee. Dr. Ashwini, welcome to 𝗠𝐷𝐻 podcast. I will leave you to introduce yourself to our audience.
Hello, my name is Dr. Ashwini Banerjee. I'm a consultant gastroenterologist at Emirates Hospital Group, and I'm available at Emirates Specialty Hospital and Emirates Hospital Daycare Surgery in Motor City.
Welcome, Dr. Ashwini, once again. So I will start by asking you, what is colon cancer?
So colon cancer, if I have to explain it simple words, is development of malignant cells or abnormal cells within the lining of the colonic mucosa or the rectal mucosa. That's basically the colon cancer is.
All right. So how does it develop?
Most of the times, colon cancer will start as a benign polyp. This polyp will grow over the period of 10 to 15 years into malignant cells. There will be malignant transformation, and that's how the colon cancer starts. Now, sometimes colon cancer can start from an ulcer or an inflamed mucosa as well, where the inflammation is not under control. For example, in patients with colitis or Crohn's disease, if the inflammation is not controlled, then over a period of many years, that inflamed mucosa can develop malignant cells, which can lead to colon cancer.
Okay, great. So what are the symptoms, the most common symptoms that a patient who has this cancer developing inside his body, what are the common symptoms that he might feel, and at what stage they can start appearing?
So the common symptoms for colon cancer or rectal cancer are rectal bleeding, change in bowel habits, which can be diarrhea or constipation, weight loss, bloating, or any unusual feeling within your abdomen. You should actually seek help to check your colon. Now, what stage the symptoms start actually depends upon what stage you present to your doctor. Because a lot of people will ignore the rectal bleeding or some discomfort in the abdomen, and they will sit on it for a long time. If you present early, then the cancer, you detect the cancer early, treat it early. But if you sit on the symptoms for a long time, then, you can have a late presentation as well.
That's really a very, very important message, I think, to all those who are listening to this podcast, that always don't ignore any symptoms, especially the ones that you have mentioned, because early detection is the key in any field, I think, of medicine, so especially in colon cancer.
Absolutely.
So who is at risk?
So the risk of, if we have to think about the risk of colon cancer, we can divide it broadly in two categories. One is modifiable risk factors, and the other ones are non-modifiable risk factors. So modifiable risk factors are things like obesity, lack of exercise, sedentary lifestyle, diet rich in red meat and low in fruits and vegetables, tobacco smoking, and alcohol consumption. So these are the modifiable risk factors.
Yeah, this is not a good news, though. I love red meat.
Well, it's the balanced diet. So
yes,
it's not like you can't eat red meat at all, but people who heavily rely on red meat have a higher risk of developing colon cancers. But it's modifiable. There are enough studies published which say that 1/3 of the cancers are actually preventable just by if you tackle the modifiable risk factors very well.
This was about to be my second question. So how to prevent it? Yes.
The second thing is the non-modifiable risk factors, which you can't do anything with your lifestyle. That is family history of colon cancer, genetics, personal history of polyps or cancers. If you have an inflammatory bowel disease, colitis or Crohn's, which is an autoimmune condition, then all you can do is you can look or screen for colon cancer early to make sure you're not developing, or even if you have developed it, you're catching it at an early stage.
Okay. So what are the tools for screening, since we are aiming to prevent it? What do we have at the moment in medicine available to screen and detect it maybe before it happens, or if it's happened already at an early stage?
Yeah. So the screening broadly can be divided into blood-based tests, stool-based tests, and image-based tests. So blood-based tests are not very commonly used, where we use detection of circulating DNA in the blood test. That's mostly available in United States, but some companies are offering that here as well. The most common test what is available here is the stool test, or fecal immunochemical testing, where you're looking for antigen to blood in the stool. Now, that doesn't necessarily mean you have a cancer, but that tells us that you need to have a look inside the colon, and you can pick up cancers very early. The image-based test is colonoscopy. Obviously, that is the gold standard. We're putting a camera inside the colon to have a look at it. And the best part of colonoscopy is you're not just detecting cancers. You're actually detecting those small polyps, which can turn into cancer in 15 to 20 years' time.
True.
So colonoscopy is the gold standard test to look for colon cancer or any precancerous lesions, such as polyps.
All right. So how often you advise the people to do colonoscopy above certain age, or is there anything like that, recommendations?
Yeah. So UAE has colon cancer screening guidelines, and in UAE they recommend that screening should begin at the age of 40 years, and you should have a colonoscopy every 10 years or a stool test, fit test, every 2 years.
All right. Is there a role for the DNA test, because we said part of it is genetics, in detecting or telling us that there's a risk for developing colon cancer?
Yeah. So you can do the DNA test. The DNA tests are available in the stool and in the blood as well. Now, as I mentioned before, like when you are thinking about preventing colon cancer, what are you looking at? Yeah, is your aim to detect cancers, or is your aim to detect polyps, which are precancerous lesions? Now, the circulating DNAs are good at detecting cancers, early cancers, but not good in detecting polyps. So yes, it has still got a role. It's got about 92% sensitivity in detecting early colon cancers, but they're not very sensitive in detecting polyps. If you have to detect polyps, the most sensitive test is colonoscopy.
So if someone has been diagnosed with colon cancer, what are the treatment options available?
So treatment options very much depend upon the stage of cancer. The stage of cancer can be from stage 0, where the cancer is just confined to the lining of the colon, to stage 4, where it is advanced and it has gone through the lining, it is involving the surrounding organs or distant organs. The treatment varies. So why the stage is important is when you are picking up a cancer at an early stage, that is stage 0 or stage 1, the survival rate after treating the cancer is almost as high as 90%, 5-year survival rate.
Yes.
So that's why screening is so important. However, if you pick up a cancer late, and that can happen if you're sitting on the symptoms for a long time, then your survival drops to 10 to 20%.
Yeah, that's good. So I think this will be the final question. So as much as we are, of course, into the treatments in the current medicine we are practicing, I want to ask you about the microbiota and like disruption of microbiota, or what we call dysbiosis as a medical term. So is there a role also for our lifestyle, let's say, on preventing colon cancer? Again and again, I will leave this as the final question and final message from you to the people.
Well, there is a big role of, I wouldn't go straight into microbiota as a role for colon cancer, because there is not enough published literature or scientific data to support that or disapprove that.
All right.
Okay. But what is already established is the food habits. So if you have a diet high in fibers, fruits and vegetables, you are certainly at a lower risk of developing colon cancer as compared to someone whose diet is very high on red meat.
Thank you very much, Dr. Ashwini Banerjee, for being with us today for these great insights. And please stay tuned and stay with us for another episode of Al Majlis podcast from Emirates Hospitals Group.